Welcome to Waukesha County GovCast, your source for what's happening in our vibrant community. I'm your host, Hillary Mintz, Public Information Officer.
And I'm Sean Lundy, Chief of Staff for Waukesha County Executive Paul Farrow.
Each episode, we dive into the latest news, community projects, and the initiatives shaping Waukesha County, where innovation meets public service. From in-depth discussions on local governance to county services, we're here to keep you informed and connected. So whether you're a resident, a business owner, or just curious about local government, join us for a closer look at the heart of your county. Well, welcome to GovCast. Today is Tuesday, April 22nd. Hillary Mintz here with Sean Lundy.
Hey, Hillary.
Hey, Sean. Well, we have a great episode for you today as we continue to explore our county departments, what they do, how they serve the public, how your tax dollars are being spent. Coming up, we'll be joined by our Health and Human Services Director, Liz Aldred. She runs one of our largest departments here at the county. But first, here's what's happening in Waukesha County. This week marks Earth Week. Our friends at Parks and Land Use are offering a number of educational programs and events focusing on making a positive impact on our environment, including the Friends of Retzer Nature Center's annual Earth Week celebration on Saturday, April 26th at Retzer Nature Center. To view the Earth Week schedule and details, check out waukeshacounty.gov/park events. Speaking of our parks and Mother Earth, golf, back in action, not quite Augusta, but a close second, Nagawaki and more downs. The pins are in. This week, we reopened the north-south wing of the courthouse, which features a brand new public corridor, allowing the public to have a direct route to family and civil courtrooms, plus criminal courtrooms located in the court's tower. We also have a new county job website coming online soon. Beginning April 28th, you can look for jobs on our new Workday career site. And, Sean and I just left the office, came here to the studio at City Hall, and we ran into County Executive Paul Farrow. He was back in the office signing papers. It was great to see him up and around. His recovery is going well. Well, today, as we mentioned, we're joined by Health and Human Services Director Liz Aldred. Welcome to GovCast, Liz.
Well, thank you for having me.
Now, you've been with the county a little over 4 years. You've had extensive professional experience serving as deputy director in Walworth County, coming here, taking the lead as director, and currently you run the county's largest department. Now, the Sheriff's Department is the largest department based on funding, but HHS, as we call it for short, has the largest staff. Now, for background purposes, HHS offers a wide spectrum of services from veteran services to aging and disability, mental health, public health. You guys are really the boots on the ground, truly helping citizens of Waukesha County. So what is that like to know that your department really has a huge impact on our community?
Hillary, it really is a privilege to have the opportunity to really have that connection to the citizens of Waukesha County. We have so many great staff and so many great programs to be able to offer. I'm really just blessed to be able to be a part of that. People come to us on some of their worst days, some of the most difficult times that they have, and many times they just really don't know where to turn. And Waukesha County has what they need. We're a reliable place that they can go to, that they can reach out to, that they know that somebody's going to be able to hear them and to help them and just help them make their own decisions and connect to the services, because Waukesha County has a number of community services in addition to what we do here at the county that really supports people. At the core of what we do, we are really providing safety for the people of our community through our child protective services, through our elder abuse and neglect investigations, some critical mental health services that we provide, our emergency response that we have through our public health division, for sheltering and those kinds of things. We do so many things, and nobody really knows what Health and Human Services does until you need a Health and Human Services. So it's really great to just have that opportunity to be connected to people and to be able to be there when people need us.
Well, that's exactly why we wanted you to come on, so we can help people understand, right, what you guys do. Well, with such a large department, pressure on governments to cut funding, we know budgets are tight. Your budget, while large, mostly funded by grants. 80% of your operations are mandated by the state of Wisconsin. So when we're looking for cuts and you're looking for, the big things to cut, but with so many mandated services, I mean, that can probably be hard to do. So how do you balance those financial pressures with the services, providing those critical services to the community and really deciding what stays and what goes?
Well, I mean, and that's a really good question. Right now, about 55% of our budget is covered by grants, and another almost 20% of our budget is covered by people's payments for the services that they receive. So looking at potentially what could happen if we receive some cuts, if we lose some of our grants, we really have, as a department leadership team, have been looking at how we can streamline, looking at that continuous quality improvement process to make sure that we're being as efficient as is possible. Really looking at leveraging technology with our electronic health records, with some of the other technology opportunities that we have to make sure, again, that we're able to do things efficiently and effectively. And then also maximizing our partners. Again, as I talked about before, we're really connected into our community. We have a community of good partners, and sometimes they can do things that we don't necessarily have to continue to do. So it gives us that opportunity to kind of network. Our community providers provide those community-based services. So we're providing the core, as you mentioned, those mandated services that the county has to provide, that we're not allowed to transition off to subcontracted providers. Really, we're very, very integrated into task force in our community, into community collaborations. One of the things that we do as our public health, as our community strategist is really to look at how we pull our partners together and figure out how we can do it together. We're not in it alone in Waukesha County, which is great. Really, when it all comes down to it, when we have to prioritize, when we have to look at what are we going to cut, what are we going to have to reduce, we look at our communities and community needs. We do that assessment once a year, talk with our community providers throughout the course of the year. We look at our funding mandates, the things that we have to do, and then we look at community safety. As I mentioned, in some of our roles, and a lot of our roles, we are that community safety piece as well. In tight budgets, honestly, we've already had to start making some of those prioritizations. This past year, we had to look at prioritizing how we do home-delivered meals because the reduction in the amount of money we get for that has already started occurring. And so we've had to look at making decisions about who can get those services and who would have to wait to receive them later.
And one of the reasons why I like doing this podcast and having different departments on and individuals coming on talking about what we do is that opportunity to really highlight, how Waukesha County just strives for efficiency. I mean, we have like 200 plus employees that are trained on Lean and Six Sigma to constantly improve processes, and we embrace continuous improvement. And with a department like yours, we talked about, Hillary mentioned the Sheriff's Department is our largest funding priority, justice and public safety. But Health and Human Services has the most employees, and that's partially because you're so heavily grant funded, and we get support from the feds and from the state. But we still have that emphasis on how can we stretch every dollar. And that is, I don't know if it's absolutely unique to us, but it is definitely not the thing that people think about when they think about their government or when they think about or they hear Health and Human Services. They don't necessarily think about these are people trying to make every dollar go as far as it can possibly go and still meet the mission, serve the community, help people when they're in need. So it's one of the cool things I like about doing this. And I think you just really highlighted, some of that stuff. So that's really awesome. We all know, kind of ripped from the headlines here that the federal government in Washington, led by President Trump and Congress, are making deep cuts in funding and proposing deep cuts in funding for programs that your department is ultimately responsible for. And so for background purposes, what happens is federal tax dollars are appropriated by Congress. That money could get sent in a big block grant to the state of Wisconsin or other states. And then depending upon the grant, the money eventually trickles down to counties. And then it's your job to help implement those programs. So you gave an example of Meals on Wheels. That's a great example. It provides pre-made meals for the elderly and the homebound to make sure that they're having nutritious meals on a daily basis. The county exec, many people here in Waukesha County who support President Trump believe these cuts are necessary, but also realize that those cuts could have a direct impact on your family, your friends, your neighbors, and the services that we're providing. So that's me rambling a lot without actually asking a question. So here it is. How do you see those cuts in Washington impacting the services that your department is providing today? And then how are you preparing for the eventuality that some of that money is going to go away?
Yes, it is an eventuality. I think you're right in saying it just that way. We've already received numerous letters from the state that we are receiving cuts, whether it's in our targeted safety services, our child and family allocation, our immunization grant, our mental health and substance use block grants, and our crisis resource center grant. We've already received the notification that that's going to be done. There's other things that are floating around there too. Actually, just this morning, we had another piece of information that came across our desk looking at cuts in our ADRC, our Adult Protective Services, our crisis, CMS, our Medicaid funding. Those are all things that are being talked about there. So we're spending a lot of time with our leadership team looking at the programs, looking at how we can streamline those, looking at that continuous quality improvement and how we can maybe adjust some of our practices, looking at reducing or eliminating non-essential services, exploring contract reductions, because we do a lot of services ourselves, but we also work with a lot of our providers to do that as well. Limiting service availability, because again, there's some services that we may not be able to do as robustly as we do now, but maybe if we were able to scale back, we were able to still serve the people who are most at need and most at risk. Looking at wait lists. Right now, it might take someone 6 weeks to get into our clinic, and maybe that becomes 8 weeks or 10 weeks in order to be able to receive the service that they need. We're still doing those crisis services. We're still doing those mandatory services, things like child protective services. We're going to do that, and we're going to meet our state timelines and our deadlines. And so that's, we can't and we won't give up those safety pieces, but really looking at everything from changing our hours of operation. Our building right now stays open till 7 or 8 o'clock at night for clinical services, and we may scale that back. And again, looking at everything from that to things like staff reductions to really make sure that whatever comes our way, we're able to make sure we can still provide the core necessary services that we have.
And in addition to some of the programs you mentioned that could be impacted by the grants, we also have a popular program here in Waukesha County, which was started a few years ago. And again, we mentioned the put the boots on the ground type of service, which incorporates public safety. And that, which is our top funding priority, as Sean mentioned. And we're talking about the embedded mental health workers here that assist our sheriff's department and local police departments. We know mental health calls for law enforcement are higher than ever. So Liz, what do these workers do? How does the program work?
We have a really multifaceted approach here in Waukesha County. We are actually working with our sheriff's office, with the city of Waukesha, with Brookfield, with our 911 call center to embed workers, our clinicians, into those different areas. And then those workers go with law enforcement or meet law enforcement out in the field when there's a situation that's related to a mental health situation that's occurring, someone who's in a crisis, and we connect that social worker to provide an immediate response. Our law enforcement in this community are phenomenal. They do a great job. I've seen them in action, meeting with people, talking with people in our community, and they do a wonderful job. They have some training around mental health, but that's not their background. So being able to put a clinician, someone who is trained, who does have the experience with the law enforcement to go out and to be able to respond, it also has the ability to de-escalate a situation, because when an officer is there, someone may respond differently than a clinician who is there.
And really, do you say that because they see an officer in duty, right? Mm-hmm. They see a gun in the holster. Is that part of it?
It is definitely part of it, right? Like, it's just the presentation. Again, our officers are great. They do a wonderful job. But if you're seeing a law enforcement officer, you're wondering what that means, and if you're not at your best moment, when you're in distress, talking to a social worker. And then one of the great benefits that we've seen is it reduces the amount of time law enforcement actually spends dealing with those situations with the individuals who are in distress, and they can go answer other calls, things that they need a law enforcement response for, and they can leave it to our clinicians to make sure that people are connected to the services they need, that safety is assured, that we can create safety plans, that we can connect them to our hospital or our resource center or our therapists or whatever service they happen to need, so that we see people having better outcomes. We see law enforcement being able to do what they need to be doing, and we're not tying them up for hours doing other work that they do well, but can be done by one of our health and human services workers. We have so many great success stories. We have a story of a family, a father who was really struggling with his child, and the child was in a mental health crisis. They called in, police responded, and police said this child is not a danger to themselves or other right now. And they left the scene, as they should. And the parent kept looking, ended up calling the 911 call center. They said, you know what? Maybe crisis could respond to this. Maybe the Health and Human Services went out, helped the father plan, came up with resources, and really, again, helped a family through a really difficult time. And now we see that family doing so much better, connected, and really a positive success.
Well, that's a great success story. Switching gears back now to the federal government. We're kind of jumping back and forth. But, as you know, we have a new director of HHS in D.C., Robert F. Kennedy Jr., and he can be seen by some as a controversial figure regarding his stance on vaccinations and other issues. And, our approach to public health is different than, say, Dane or Milwaukee County. And during the pandemic, Waukesha County, we didn't issue public health orders. We gave really common sense guidance and didn't restrict people's movements. Our main focus was to keep our schools open. And Waukesha County kept all public schools functioning and, very importantly, in person, not virtual. The Public Health Department and County Executive Farrow held weekly calls from the time the school year ended in spring of 2020 through opening school in the fall, and worked all summer long to get kids in person, back in class, making sure staff and students were safe. It is such a different approach than what we've seen from some neighboring communities, especially to our east. And you came to the county around that time. So with that common sense approach to public health, and in DC, the public health, those two words still, now 5 years later after COVID, the pandemic, are lightning rods. So what are the challenges to balancing that common sense approach with the controversy that surrounds that topic?
Well, I think one of the things is that public health is so much more than what people think public health is. Right now, when I talk about public health, public health is emergency preparedness. Again, we responded in January of 2024, our public health, to standing up a shelter when we had a winter weather situation and people were homeless, without meds, without the electricity to provide their life-supporting equipment. We responded. That's a public health response. As I mentioned, we are the chief health strategists in the community. We pull people together. We pull entities together to problem solve around some of the big issues in our community. WIC. Most people know what WIC is. It's the Women, Infant, and Children's. It's a nutrition program for families who are in need of support for babies, but up to the age of 35 years old, and really making sure we work on breastfeeding and those kinds of things. We have safety services, like we monitor for tuberculosis and make sure people are quarantined and get the health resources they need. We have a travel clinic where, a lot of people like to travel outside of the country, and you need to make sure you've got the things that you need to be able to do the traveling, and we have that resources that other people don't necessarily have. So when you take that and you look at that kind of broader picture, you go back to what you were talking about with that really different kind of approach where our approach really is to help people make their own decisions, their own health decisions. It's not our job to make your health decisions for you. We want to make sure that you feel as a citizen in Waukesha County that you're going to get good information, trusted information, and that you're going to be able to make your own choices from there. So if you want to travel outside of the country, this is what you need to know. If you need the resource for WIC, and you'll be able to come in, learn about some of the healthy baby things that they have, learn about breastfeeding, and get connected to those resources. Some of those are fiscal resources like vouchers for formula. You can get those things. And again, really trying to make sure that people have trusted information. We are, and Waukesha County has been for quite a while, one of the healthiest counties in the state and one of the healthiest counties in the country because we take this approach, because our citizens have the information to be able to make the decisions that they need to do. Our really focusing on just that communication piece, being transparent in what we know, what we don't know, and supporting people in kind of having the opportunity to continue building on that public trust, and just kind of making sure that people have the resources they need to be healthy.
Coming up at the end of next month, kind of the unofficial kickoff to summer, we have Memorial Day. And, that's a time when we think about those who have served our country. I mean, the people who have paid the ultimate sacrifice, the brave men and women who have fought for our freedom. And, talk about the departments that you guys have at HHS. Another one we wanted to highlight is our Office of Veteran Services. And that's an office that's not just thinking about it a day or two a year. I mean, it's a 365 operation. So can you speak to a moment about the services that they offer?
Yes. Our Veteran Service Office looks like a very, very small office, but the individuals we have working in our Veteran Service Office do an amazing job. They are seeing more and more veterans every year. One of their biggest roles is really helping establish initial eligibility for state and federal benefits for veterans, for veteran spouses, and for their dependents, and making sure that veterans in our community have those resources. They really work with even veterans who are already established to make sure that they're getting the maximum allowable, eligible benefit that they deserve based on their service. As you said, these people served our country, put themselves out there, and they have earned these benefits. So they come in, and maybe years ago they were only 30% eligible, and now there's more categories. There's more things that they become eligible for, and now they're 100% eligible. And not only the veteran themselves, but their spouse and their dependents. So really, we work to connect to the benefits, to filing their discharge documents and recording those, to claims for compensation and pension, and then really some of the other benefits that they get through the VA system. Our veteran staff are able to talk with them about whether that's the GI Bill or veteran loans for housing, those kinds of things. In this community, our veterans receive almost $400 million worth of services and benefits based on their service.
Wow. Last year, County Executive Farrow was at the grand opening of a new 8,500 square foot VA clinic in Oconomowoc. That location really bridges a geographic gap for veterans who need services in Waukesha County and surrounding communities without having to travel to south side of Milwaukee for healthcare. So what is the opening of that new clinic meant for Waukesha County veterans?
It is really exciting. Our veterans now, as you said, have other options of where they can go. They're connecting closer in their community. We actually also do outreach into that center. We actually have one of our staffs placed over there throughout the course of the week so that we can make sure that people connect. People are getting easier access to their medical care. They have some psychiatric care there as well. So really, again, kind of bridging those gaps. So really tying all those things together. We actually, in addition to that outreach at the the Veteran Center in Oconomowoc, we've been doing some additional outreach. We outreach to all of our VFWs, all of our American Legions. We outreach a lot into our skilled nursing facilities in our community. And recently this year, we've added outreaching into our police departments. Not surprisingly, many police officers are also veterans. And so we want to make sure that we're connecting to people so that they know what services they're eligible, even if they don't need their benefits now. They may need them sometime down the road, and to know that they're even eligible and that they could outreach and where they could outreach. We're getting some good feedback from our law enforcement partners to be able to say, that this is new information for them. It's good information for them. So really tying, again, that community together so that we're all working to support the people in our community.
That's awesome.
And at last check, I was told we have about 18,000 veterans in Waukesha County. So extremely important services that we provide. Well, Liz, what a great conversation we had today. We can't thank you enough for being here. And if you're a veteran or a citizen needing help or assistance, you can check out more on the Veteran Services, their website. You just go to our homepage, waukeshacounty.gov. That top tab, you'll see Living in Waukesha County, and then you'll see veterans listed there. Well, thanks for watching and listening. Subscribe and follow GovCast, and we'll see you next time.